Good morning, Dr. Lebowitz at the Long Island Gynecomastia Center. So today I've got a touch-up. I got a young man, he's 29 years old, and from Pennsylvania, and I'm doing a touch-up on him because I guarantee my work. Now I do a touch-up, if you need one, if you're crazy, like I had this one guy who I did glands 2.5 years ago, and he wanted me to remove some skin up by his armpit to lift up the chest, and he looked great. And I just won't do that, even though he says, no, I want the scar. I know better, to not to give people unnecessary scarring, because once you do something, you can't undo it. But this young man, I want to show you his pre-ops right now, the front, the quarter view, and the lateral view. And here he is today. He's 8 months post-op, and he looks amazing. I did his belly. I didn't do his whole belly the last time because I was kind of intermixing on whether I do it or not. But something, I'm here today, and if he wants me to, I'm going to go down. I'm going to make a little hole and put a little drain there. But I want to give him a six-pack. I think he'll be doing great and go down here. But he looks great here. The only thing that bothers him is a little bit of fat right there. He wants a little bit more of a hockey stick shape. And as a gift to him, I'm going to etch his six-pack a little bit more, get around here, do something that I didn't do back 8, 9, 10 months ago. Maintain volumes here. The glands are gone. They're totally gone. And that, if you zone in, that's the scar from the gland removal. You can't even see that. And zone in here, the same thing. This side's even better. But the glands are gone, but I'm gonna etch his six-pack here, etch his lats better, get the six-pack. I mean, he looks amazing. We're gonna do it all, and we're gonna just make him happy. He's actually a great guy, and and he's great to me, and I'm great to him, and that's the key. So when you want something in life with people, always be nice. You attract more bees with honey than with vinegar. So never be nasty to anybody. Be nice to everybody, and you will get your way. So I'm gonna numb them, mark them, and let's go to the OR. So here we are on this side, just remelting all this and retightening it all up with the Vaser. Under local, I swear by my work, unless you're crazy. If you're crazy and you want me to do things that are absurd, I won't do that to you. So now we are on suction. This is the Mercedes long. Going in there, and let's do some lipoing. Get some of this melted crap out of them. Give them more definition. Trying to get your lower back here. Got it a little bit there? So now I'm doing the midline. So I did the semi-lunaris, so you can see those nicely. And now I'm etching the midline here to scoop that little bit off right there. All right, Dr. Lebowitz at the Long Island Gynecomastia Center. Beautiful job. Redo. I did them almost a year ago. Called me up a couple months ago and said, Doc, I look great. I feel great. I want a little bit more, just really by the pectoralis major muscle where the gland was, where the gynecomastia was. But I did more for him. I did this back then. I didn't do the whole belly. Now I'm doing the whole belly. So you're here. Let's do the whole belly. So I did the six-pack. I did the lats. I did the serratus anterior muscle, I did the pecs, I did the six-pack, I did the midline, I did the semilunaris, I did it all. Put in drains, because that's what I've been doing lately. Redo, I took out another 2¼ liters out of him, and he looks amazing. You saw for yourself what he looks like. So call me, Dr. Lebowitz, if you're primary gynecomastia or redo gynecomastia, I will take care of you. I promise. 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. We'll talk and we'll make it happen.